Tech New for Get Healthy Perry, and today I will be talking with Chris Brill-Packard from Lake Health. Chris, can you please tell us a little about your role at Lake Health?
My role is professional outreach rep, and that means I work with employers of Lake and Geauga County with occupational health and wellness programs.
So, why do you feel it is important for our society to change its current habits in order to become a more healthy society?
Well, I think what we're all experiencing is increasing insurance premiums, whether the employer's paying more, the employee's paying a greater share, or both. Mm-hmm. And what we're seeing is a steep incline in those healthcare costs from an insurance standpoint, where everybody's having trouble giving pay raises, etc., and trying to meet budgets. So what we're looking at is trying to decrease that, and that's by decreasing utilization dollars. And that means healthier lifestyles, because if we're healthier, we avoid heart disease, heart attack, stroke, diabetes, and a whole range of diseases in that process.
So what is Lake Health doing to help educate people in order to foster this change?
Well, Lake Health has been a community-based facility. Our CEO, Cynthia Moore Harding, has always been very strong in trying to help our community become a healthier place. We believe that if we have the wellness programs, diabetes education, nutrition programs, exercise programs, we started a wellness institute this last year. If we bring those resources through our physicians, our nurses, our dietitians, and expert staff, we can help the community member actually become more educated, the employer, and try to bring about those programs that help everyone so that we can keep our jobs in Northeast Ohio.
Back in the fall, Lake Health conducted a health screening for the staff of the Perry School District. Just over 60% of the staff participated. Can you give us a brief recap of those results?
Certainly. The Perry School District, we had about 60% participation. And we saw some normal percentages within the population, and we compare it with our Lake County region, and we also compare it with our national. We had about 59.3% were overweight. So that meant overweight, moderately obese, and severe obese. So we put those together. Yeah. We had a little over 16% saying that they have arthritis. We had 24% saying that they have high levels of stress. We had 44% saying they experience allergies. And we had 19% actually identify that they did not have a primary care physician, which is a key component of wellness. If people do not have a primary care physician, then they're missing their annual screenings, their checkups, and that's a real missing link when we look at wellness.
How does the Perry School District's staff results compare to the national average?
Well, in the obesity categories, it was about 3 to 5% higher than the local and the national. They were a little bit higher for arthritis, and they were higher for the stress, and the seasonal allergies, they were higher. And so we're hoping that we can identify some programs that will help people do better with their coping strategies for all of those areas.
Can you tell, hold on. Sorry, you skipped over the question. Should I just pick it up from there?
Yeah, that's fine.
Can you tell us how Lake Health is helping the faculty at Perry become more health conscious?
Well, one of our recommendations for the school district, for the faculty and staff, was that we would design a weight loss exercise program, because we believe that that would be a key area, because that was one of our largest indicators for future healthcare utilization. Also some exercise activity competitions, because we want to foster the well person staying well, because if we can keep the people who are already at proper weights and have good health habits, keep them in that flow, then they'll not go into those other bad risk factors. We also anticipate that we'll be designing some lunch and learn programs on arthritis, stress management, allergy control, and we'd like to do a little bit more on hypertension control because high blood pressure is an issue. And we were thinking that we might offer some quarterly blood pressure checks. We saw an issue within the survey in that people identified themselves as having high blood pressure but not taking any medication. And if an individual knows they have high blood pressure and they're not taking that medication, they're at higher risk for stroke. So we thought if we did some additional blood pressure sessions, we could have more opportunity to educate them as to why it's so important to actually be on medication and take care of that.
What are some steps the students and community members of Perry can do to become more health conscious?
Well, one, we'd like them to participate in the screenings. We are going to do a rescreening in the fall. We'd like them to participate in the Lunch and Learns, whether they were in the screening last year or not. And I think the students can actually be role models for adults because you have all these activities that you do, and by maybe teaming up with staff and faculty, we can have some interesting buddy systems.
Chris, I'd like to thank you for joining us here today. For Get Healthy Perry, I'm Eric Neo.